Assalamu alaikum. I'm Dr. Tahira. Welcome to Health is Wealth, the first program of the new year. Happy New Year. This is 2025 and we thought why not bring to you the best New Year resolution. Usually it is all about physical fitness, academic or social goals, but we thought this time you should be focusing on your mental health so that we can have you focus on your mental health, get stress free. We are here today at Psychiatrist Dr. Ehsan Naveed's clinic. Assalamu alaikum. Welcome to the first show of the new year 2025 and we are on Health is Wealth and we are discussing what is most important to us this new year. Obviously, it's our mental health. Mental health is the thing because physically we might be very aligned. We are, having resolutions to improve our physical health, our fitness. But what is actually eating us away is our mental health and we don't pay enough attention to it. So we thought, why not start this beautiful new year with a beautiful note as to how we need to take care of our mind, our thinking and of the thinking of the loved ones around us. We are so grateful to Dr. Ehsan Naveed. Thank you so much for joining us today. He's a psychiatrist, a very well-known psychiatrist who has immense work on mental health. Thank you so much for joining us today. Happy New Year to you. This is the first program of this new year and let's start on a very good note. So first things first, how important is mental health for us?
Well, Happy New Year, ma'am, and to all the viewers. So for every new year, we get really hopeful. So that's why we have those fireworks in the night and we want to go and enjoy and we want to spend some good time. And the ones who do not have a day off before the new year, they really, want to spend in the similar activities. So obviously, without mental health, now it is proven. Everybody knows about what depression is. Everybody knows about what anxiety is. There's been a lot of talk about social media and a lot of influencers have been talking about that. So obviously, with a good mental health, I think Pakistan has a chance.
It does? Well, the worst thing about last year, and especially a few years before last year, has been a lot of hopelessness. We as Pakistanis, as a nation, we are hopeless about everything. We keep saying, oh, there's no future for us. Our future is very bleak. Nothing is going to happen. Nothing is going to work out. Can you please stress upon hope and how important it is to hope for good things in life?
Well, this is not the first time that the nation has, been in a financial situation like this. I'm sure that every generation thinks that their time is the best or they have had the hardest of the things. But if we sit with our parents, if we sit with our grandparents, they have similar stories. And so the most important aspect is to identify and to realize that yes, we have a financial situation in the country and in our homes. And so the first thing I would recommend is, as a lot of people walk into the mental hospital where I work, so when we dig into the assessment and history, the main problem that the people are facing is not being able to have a financial budget. I mean, they have this problem. They do not have this habit to make a budget, one. And two, a lot of people, they go go out and take loans from other people and from their family and their environments. So these two things, I think, needs to be managed.
So basically this thing about debt, because people start getting into debt. So their New Year resolution should be that we are not going to take any more debts. We're going to have expenses only according to what we can afford. And we're going to make efforts to earn something rather than beg here and there.
Absolutely, Tahira. I mean, so making a budget in terms of psychiatry or psychology is very important because it has a direct and an indirect relation with our happiness. I mean, when we talk with normal people as well, when they in the form of parents and family caregivers. So when somebody has money in their pockets, this is what a common man feels. He is very happy. His day is very happy. His diary is very happy, and so that same person, when when it goes in the bills or the student fees or in the other traveling, he or she gets very sad. You see, so make a budget, put your expenses. This is the resolution, and to and figure out that what is there, what's the problem going there.
Okay, when we talk about anxiety, right, can you please tell me what exactly are anxiety disorders? Because a lot of people have a lot of anxiety when it comes to making money, when it comes to exams, when it comes to, applying for a job or in their daily life. They get very anxious before time, or relationships. They get scared, they don't want to do it, they have all these fears. How do we cope with anxiety and what exactly are anxiety disorders?
Okay, so if you talk about stress, which leads to anxiety,
Right.
so there's this normal stress. I mean, the stress before a talk show. I mean, just like I was
Right.
preparing for
Yeah,
this
yeah.
talk show, everybody has this. So that's the positive stress. It's called the U stress. I mean,
Okay.
for example, if we are going at a five-star hotel, we have got a complimentary stay there. We are driving and we don't have much time left to check in. We have that positive stress, you see.
Right.
But at times, absolutely, ma'am, this U stress becomes the distress.
Okay.
Now, the distress means when the thoughts of or you know when the main supposed event is happening creates functionality problems.
Right.
Okay, functionality in a sense that we cannot work, we cannot be the same son or be same husband, same daughter, same husband, same boss, same worker in the office or at a home, and it creates a lot of somatic like bodily complaints inside the body, like rushing of our heartbeat, getting our throats choked, sweatiness in a situation, tremors, and if it happens for a period of 6 months, so it's called generalized anxiety disorder. A lot of people do have tender pains and all, and I was, going through the Oxford manual, the latest one, which has arrived yesterday, because it's the new year, and so I was going just through the reflection, and so they said that 80% of the population having anxiety disorders, they are not taken as anxiety disorders by, let's say, the local peers, the spiritual model we have in India and Pakistan. We have this spiritual model in all the religions, or the general practitioner, or the other specialist doctors. So they're just like, you've got weakened nerves, you've got
they
tingling
keep
sensation.
It's something or the other. Maybe they're possessed by some supernatural force, or they have some other, or they have lack of interest in religion. Because the first thing they do is they tell them, oh, you're not praying enough, you're not a spiritual person. Whereas it has nothing to do with this. It is just like any other part of the body, I assume, right?
And so you see, I mean, if somebody walks into a proper psychiatrist or a mental health clinic, he or she would be given a plan of assessment, and then they would definitely engage the patient into a structured CBT. I mean, having a structured CBT is also very important. We've got very few licensed therapists in the country, and because of some incidents which happened 2 to 3 years of the counselors and the patients getting into trouble, now we do. I mean, the Khyber University in Peshawar, they are offering this structured course for the psychologists to go in, to the doctors who even are not psychiatrists. They can just walk in, get enrolled. There's another course by UHS Lahore, and similar international courses are available. So the structured therapy consists of about 10 to 12 sessions, weekly, 1 hour. We can, patients have to spend for themselves. They have to sit with their therapist. But here's the core thing: a good therapist never suggests, never judges. So I mean, it is the main problem is that anxiety person, what we do is we have to help that person to make decision-oriented goals for themselves. We help them to help themselves rather than we just.
When you talk about actually helping someone with anxiety, is it usually with psychiatric medication or anxiolytics, or is it via cognitive behavioral therapy or counseling? And please do stress the importance of a difference between a psychiatrist and a psychologist, because a lot of psychologists and people who have just done 2 or 3 courses in psychology are calling themselves psychiatrists and actually prescribing such potentially hazardous medication. So if you could stress on the difference of realizing who is actually allowed to prescribe medication and who is allowed to work in conjunction with a psychiatrist to just give counseling.
Right. So as per the Pakistan Medical and Dental Council, which is our licensing authority, somebody who's had at least an additional qualification in the form of any specialty, let it be cardiology, gynecology, or a psychiatry, is allowed to prescribe the medicine.
So what is the role of anxiolytics?
Okay, so anxiolytics. Okay, so if somebody is having, let's say, moderate to severe anxiety, so he's not being able to swim, gym, go to the shopping, study for the exams, focus, and the thoughts are keeps getting those pessimistic thoughts about anxiousness or being dread. Then obviously counseling, which is the CBT, and the medicines, they work best. But let me tell on your platform that it's not forever. I mean, people think that once they get the medicines, they would just end up by getting the medicines for the rest of their lives. It's not true. People who have diabetes, people who have got hypertension, obviously we are all the same people, we are humans. We take if you've got hypertension, we're going to take that medicine for the rest of our lives. But a lot of 99% disorders in psychiatry that the people are having, they've got a limit. I mean, for anxiety, it takes 6 to 8 months for the complete recovery. For, let's say, recurrent depression, somebody who has got, depression, in which the patient becomes recovered and then again gets the history for 2 years.
Do you have any exercises in mind or any advice for somebody who is currently, facing with anxiety? Before they do anything, they have this analysis paralysis. They keep thinking, oh, if I do this, something will happen. If I do this, what will happen? I'll fail. I cannot do this. I'm not good enough. What is the one exercise or mental exercise or attitude that they should adopt to be able to overcome this great hurdle?
Okay, so the first thing is the self-help. Okay. So if it's a pyramid by the WHO as we talk in, the baseline, the majority of the chunk people get better with the self-help. And the self-help is, the main thing is our breath, you see. So the breathing exercise in which we take the breath from our nose and then hold it for about 5 seconds and count 3, 4, 5 in our hearts, and then we just blow out as if we are blowing the candle. So breathe in as if we are smelling a beautiful scent. Hold it up and then blow out as if you're blowing the candles on our birthday cake. So this is the deep breathing exercise, and there are a lot of videos available on the YouTube and on the social media. The other thing is the PMR, the progressive muscle relaxation. It takes around 15 to 30 minutes, and it starts with the forehead. So how it is done is that, for example, if this is my forehead, I'm going to tense it up. And then I'm going to take the deep breathing exercise, hold it, and then blow out. And then I'm going to release it. And then is the cheeks, and then is the neck, and then the...
So what exactly is mindfulness? They say, you have to imagine 5 things that you can see, 4 things that you can smell, 3 things that you can taste, 2 things you can touch, something like that, right? So how important is that? Is it important to, if somebody is actually anxious and you tell them start doing this, they'll think you're crazy. Why are you telling us this?
So we tell our patients that before you sleep, I mean, there should be a 1 day. So we used to hear when we were growing up in our schools that before you sleep, just go around your day, what have been you doing and all that, right? So here's the added portion. Believe that you're the best in the world. Believe that.
Best, huh?
Obviously you are.
Right, okay.
And believe that you're the best in the world. Believe that you're there, what you want to do, why you want to do, you're there at that point. And you're the most happiest person. And these mental exercises, because you see, I mean, it's a muscle, the brain. Okay, so if you're practicing it with the positivity, with the mindfulness, and with the meditation, with the deep breathing exercises and the positivity, a lot of good is supposed to happen, because that person obviously becomes another person that he wants to be.
It's all about positive thinking. Whatever we are going to think, our energies of the body is going to align itself that way. And they say the universe also conspires, right?
The Yonder Ray book, The Secret. It's a wonderful book. It really works, I'm telling you. I mean, in the normal population.
So it is a secret to life and happiness.
The secret of life is to believe who you want to be and believe that you're there.
And if you take a decision, then we don't regret it, or don't go listening to opinions about it, right?
Well,
what do you say about that?
We should never go in our past. You see, I mean, even for me, I mean, I had a landlord, and I happily left that place. And so it was gone. You see, I mean, I happily.
So you let go of it.
Let go of it. And after some months, I just called him again, and I was like, can I get it again? And he was like, no, Dr. Saab, you just left the place. And I mean,
so don't go back on things, whether it's a relationship, whether it's a job, whether it's
if it's a relationship, that person, the whole of the circle, block it. Do not go. I mean, this is my advice personally. I mean, because it will time and again keep our pain circle alive. And it's just like pinching our thing.
Exactly.
So just block them out.
They say, if a wound, if you keep scratching the wound, it's never going to heal. It's going to become cancerous one day.
Exactly.
So you have to leave it.
And you've got a very life short span in about 10,000 years of this universe life. You see, I mean, 60, 50, 30,
exactly. So we
70.
have one life to live. We only live once.
Yeah.
I think that should be the resolution for this new year. We only do live once. What about PTSD or post-traumatic disorder that we call it?
Yeah, I wanted
Let us talk about that, and guilt, and this immense amount of grief after that.
I wanted to talk about this. So PTSD is the post-traumatic stress disorder. if something traumatic happens, like for example, if it's a war or if it's like a catastrophe, an earthquake, or unfortunately if somebody is a victim of sexual or a physical assault. So these thoughts, if start to happen, and if they are recurrent, if they are traumatic, and if the person is reliving that over a period of more than 1 month, then it is called PTSD. I mean, where I belong from, we had the 2005 earthquake. And
yes.
it's 2025 now.
Right.
People still report
Yeah.
that they are having those feelings and they get this panic attack and they
Yes.
think that it's going to
It's
collapse.
going to happen again. Yes.
You see, and same when we when I talk to the victims of physical assault or sexual
Yes.
assault.
They keep having those nightmares repeatedly.
Exactly. And why I wanted to talk to you about this is because recently on the social media, there were a lot of painful images
Exactly.
from XYZ incidents,
Right.
which people were seeing. And then after a month, it's like obviously the start of January now. So they started feeling trauma and they could not identify from where is that coming from. And then we had to, assess them, and it was because of something painful that they wanted to see.
Please tell me, why are people addicted in our part of the world, especially in Pakistan, to these very, very frivolous and stupid news channels that for their ratings or likes, they start putting these very gruesome, very grotesque images. You see, we had a lot of plane crashes in the last 1 week, and we have repeatedly those images coming up, people dying, burning, all of that. And then all the kids around us, they keep watching these very, bloody images, even so much so that there was a time when such dramas were being, glamorized in our society, where there was a lot of killing and violence involved. So could you please stress why they should not be watching such content?
There is a complete reference in our Oxford, in even a lot of other references in psychiatry, which go through the research throughout the world, talk to people, go to the doctors, talk to the government, top hats, that the proper reporting is very important to keep a mental health well-being of the nation. The more sensitization we do for the suicide, the more we make it charismatic by seeing somebody dead. It brings a negative impact.
Exactly.
And what happens is, this is for the news channels, I mean the other ones, because we are the government channel, and that the people will stop watching your news channel. I'll talk about myself. I mean, I used to watch PTV. I mean, I remember that when my father took about 16 gold medals when he was, after his MBBS, and may God bless him, Naveed Sahib. So, so he used to tell me that I used to come over I came on the TV for 10 minutes and I was repeatedly going on the stage for my medals. And the governor back then, and A.J. Khan Sahib, may Allah bless him, the professor of medicine, he was there, the principal. So there was one TV channel and we would stick to them, and it was very, very responsible. I mean, we were all safe. I mean, we knew nothing vulgar would happen there. And then the cable, the dish antenna and the cable came, and then
everything is uncensored, unfiltered, and children are,
So when I was a kid, I was watching Cartoon Network, and then I changed the channel. My grandfather, Dr. Irfan, he was the first psychiatrist from the north. He just took the remote and he said, it is very fast. I did not know what fast is, but he was like, do not watch it. It is very fast, with politeness. Now I realize that, you see, I mean, for somebody like us, it's just because of the failure to report sincerely.
Exactly.
I mean, and people have stopped watching all of
good
those
content.
bad
We have
content
lost our
and all
identity in this process. And could you please also tell our audience today, our viewers, especially as it's the new year and everybody should change things about them, that when they give their tablets or the phones to their children, young children, they're exposing them to a whole new world of social media. Now we have YouTubers and their very twisted reality and their perception, which destroys the self-esteem, image, identity of children. And that is why more and more children are being plunged into depression, later on addiction, and suicide for that matter. Even these dramas are glamorizing suicide as if it's something very good and acceptable. That the hero commits suicide, and the things that are legal are being shown and portrayed as something deplorable.
Absolutely.
So the role of social media.
So I'll link it with autism. You see, I'm an autistic child. He's fantastic in his mind.
He's
just
sharp.
there. He's just there, and He's just thinking and he's disconnected with the reality.
Right.
So when we are giving somebody a cell phone, he becomes autistic. He's disconnected with the reality, what the mother is saying, what the father is saying, what the reality is. He has a school homework, he has to go to play with the children, and he becomes a part of that fantasticness.
Yeah.
So even the owners of these social media outlets,
exactly. They don't have it at their home.
At
I've
their
heard
home.
Mark Zuckerberg says
yeah.
that he does not give it to his child. Can you believe it?
Because we were the earliest to be on the Facebook back in
2008.
He launched in 7, but I was
in 2008.
8. I was in 8 as well. So we had this opportunity to message
we did.
him and
you
all that.
Remember we had that social chat where we could talk to him actually.
Yeah. You see, so I mean, they have very strict guidelines because they know that it's so obviously it's a message that this should be a. Obviously, we cannot. I mean, there have been a lot of reported cases. If we take away the phones, it ends up into
more withdrawal symptoms there.
Withdrawal symptoms, absolutely. So we need to have a limit. There needs to be at least a 1 hour. And there is another thing. The eye protection sleeve, the glasses for the children. Those are very important. So if the child has to use the cell phone, he or she needs to wear the protection eyeglasses shield.
And for a limited amount of time and watch what the parents think is good for them. It should not have violence and too much of excitement.
Do you remember Anak Wala Jinn? There was a drama back in those days. I mean,
it was a very innocent comedy.
It was amazing. I mean, it was our life. I mean, back in those days. So I used to wait 6 days.
But see, there was so much of waiting involved, and there was a reward feeling. The problem with kids nowadays is they're being, bombarded with a lot of entertainment. So they've forgotten how to not do anything.
Exactly.
They don't know how to get bored.
Exactly.
So they easily get
there's
bored.
This cultural shock, even in Pakistan, that they are having. They think that, a lot of people think that the true culture is what they are. They have got this bubble of life inside the phone. They've got thousands of followers, a lot of people to comment and all that. And then in the reality, it's not.
It's not there. Nobody comes to their funeral. Nobody comes when they need something. So could you please tell about these, this latest trend of people becoming YouTubers and then, exposing their family life and very unrealistic things on YouTube where they're, where the husband is giving flowers to the wife every day. It doesn't happen anyway. And, expensive gifts and all of that, and they're showing it. And the rest of the whole nation is going into a inferiority complex, a depression. They keep feeling, low. Oh, our husband doesn't get us anything. And then, there are fights. So can you tell them these are unrealistic, false, pseudo images that they're being portrayed?
Yeah, absolutely. I mean, it's very double-edged sword. I mean, for somebody who's a professional and he or she wants to do something for the sake of money or for the sake of fame, for the sake of, I would believe that everything that somebody does on the YouTube or on the social media should be for a positive purpose, for the nation, for the people, for the unity, for the perseverance, for a positive message, for mutual talks, for negotiations, stuff like that. I mean, there should be a positive image because we all are victims of this social media. I mean, ma'am, believe me, 90% patients that we are having from the civilized cities, they are, they've got problems because of social media. Somebody saw their message, somebody didn't reply for their message.
This, stay online syndrome. The whole night they spend on why somebody was online and didn't reply to us.
Another way is to turn off the notifications from, let's say, WhatsApp or Facebook. So my cell phone is very different. I've turned off all the notifications.
No, but then people start questioning you on that as well. Why is your notification off?
So I've got a message there. Call me if it's important, and otherwise wait for my message.
Exactly. So that is very important. You have to set boundaries and you have to know where to draw the line. And I think it is a very famous saying that your freedom ends where my nose begins. So everybody has to have that barrier right there.
So since it's a New Year resolution, how were you able to be successful from the recent ups and downs in life? Would you just share that if I ask you?
I don't know whether it's called successful or not. Successful, I think, would mean for anybody out there is to continue their life and not let it affect their productivity, right? If we don't allow anything else to affect our productivity and our day-to-day activity, that is success, because otherwise nobody else is happy. We will come back to that, but first let us address depression, because everybody out there is crying and crying and crying and depressed, and including me and you and everyone else. We don't know how to process this grief. So how is what is the best way to cope with depression along with sunlight, exercise, outdoor activity?
So you see, I mean, these days we've got this seasonal affective disorder.
Because
In the
it's winter.
it's winter. The sun is, not at its peak.
Yeah.
So in winters, it would happen. We would feel lethargy. We will feel weakness. We will feel sad. And the best way out is to take vitamin D course, get it checked, and take it for about 12 injections. One injection a week. Sit in the sunlight for 30 minutes. That we did a bit.
We did
earlier.
a bit earlier. Yeah.
And yes, meditate. Talk
What about
positive,
doing a lot
listeners.
of positive work, helping people around, planting trees, gardening, being connected with the environment and with people? When you ask me,
It
this
really
is my
works.
answer. I think social service is the one thing that keeps me happy. And I think we should advise this to more and more people around us to be connected to humanity. The more humane work they're going to do, the more meaningful work they're going to do, the better they're going to feel about themselves.
Yeah, I mean, if somebody is angry towards us, take a breath and try to help that person, that why that person is angry.
Empathize, put them
Empathize
in
with
your
that
yourself
person,
in their shoes.
rather than just bombard and tell the person that, oh, I'm more angry, I'm son
So
of
what
a
is the
bigger
best
man.
way to do anger management? What is one of the best ways? You said take a deep breath. We spoke about mindfulness. We spoke about what is the other ways?
For somebody who's having persistent anger,
Right.
if it's not getting controlled, come to a psychiatrist. I mean, that's very
How
important.
many sessions with a psychiatrist usually are needed? How frequently are they needed?
So, well, if it's, for example, let's say because of addiction, if somebody is angry because of addiction, then it's an altogether different thing. We have to fix the addiction in order to somebody to be better.
Okay.
If it's from a borderline personality disorder, we have to do the DBT, the dialectical behavioral therapy, and obviously it happens for more than 12 sessions, for someone. So it takes around 6 to 7 sessions for things to
And it
start
helps.
with. And it helps.
When you talk about borderline personality disorder and then you say histrionic type personality, what are these disorders all about?
So we've got 3 clusters,
Yeah.
cluster A, B and C.
Okay.
So these are, in one of the clusters.
Okay.
So histrionic means self-centered, gaining attention.
Narcissistic? Or no?
Narcissism? Okay, so that's another personality disorder.
That's another
So
one.
in histrionic, people are very self-centered and they want to be the center of
So they're
attention.
hyper all the time, are they?
Maybe it
Okay,
comes
they
with
don't.
aggression.
Okay.
The narcissism one, the
Yes.
narcissistic one, who believes they've got this self-inflated
grandiose.
self-esteem,
Yeah.
they're grandiose, they think they're the best, they're son of the best person, they are the best people around
Yeah, and
them.
they have this right to, actually put down other people.
Yeah, they do that. I mean, they,
So what about
yeah.
people? What about especially people in relationships with narcissistic people? I think a lot of people would be interested in this. How do they deal with somebody who's a narcissist?
a proper marital therapy. It really helps. I mean,
Marital
now,
counseling, you mean?
marital counseling. I mean, and it's very helpful. I mean, the people who have who've been labeled as being narcissistic,
Yeah.
eventually they are not. I
Right.
mean, maybe the couples are not, identifying each other, miscommunicating, or if there is any extramarital affair,
Yeah.
these are the things mainly which, comes up to
Right.
the couple of therapy, or maybe if there is something else. So, obviously marital therapy is very important. Couples should go to the marital therapy.
They should be. Okay.
They should be,
So what do you say is a bipolar disorder? People who sometimes are so happy and they are in the state of euphoria where they're actually showering the other person with so much of love bombardment, and the other moment they become totally indifferent, very rude, very aggressive, very violent, and sometimes very mean and negative with the other person. And the other person remains confused throughout, not understanding that which one to trust. Who is my who is this person? Well, it could be a boss, a child, a spouse, whatsoever.
So before that, since you've asked me about
Bipolar.
depression, the
Okay,
major
first
depressive
depression.
disorder, it is linked with the bipolar.
Okay.
So if somebody is persistently sad from 2 weeks, is having sleep problems, is having excessive worry or guilt, or is not being able to, let's say, perform at work, and is having the suicidal ideas,
Yeah.
he or she must go to a psychiatrist.
Okay.
For the proper medications, for the proper counseling, and it's very important. And you see, I mean, suicide is such, unfortunately, common these days because of the
Yeah.
misreporting of the other media
Exactly.
channels, that, I mean, and then they try to blame everyone. I mean, so it's a big responsibility. We have to control the drugs. We have to
Right.
involve the legal officers. We've got to involve the police. We've got we'll involve the social workers, the arms controls. and even the pesticides controls and the drugs, the pharmacies, in order to prevent a suicide. I mean, it's very, very. So if somebody has got depression, the ideal treatment is minimum 6 to 8 months as per the NICE guidelines. And in which once a month the patient has to go to the therapist or the doctor, and he needs to get the treatment, and it would include the behavioral activation and to meditate and to socialize and to start gym, start working on them. I met a patient here in Banigala who was a severe patient of depression, was on medication, and when we were tapering off the medicines, she started gym. And she's wonderful, and she tells me yesterday, Dr. Saab, I've lost 10 kgs.
Oh,
and
really?
she was like really obese.
Okay.
And I was like, wow, tell me, how did you do it? I really want to. So in bipolar, so it's just like since our earth has got, you know, 2 poles, the north and the south pole. So there are 2 poles in the mood. The mood
Extreme
is not
poles.
extreme poles. In one pole, the patient, if for a period of, let's say, 1 week, becomes manic to an extent that says that, oh, I'm a prophet, or oh, I'm the prime minister, I'm the president, or I'm the chief of anything.
Yes, yes. We have a lot of them around us every day.
And becomes hyperactive, talkative, spending spree. I mean, going to the shops and purchasing thousands of things. And then, you know, elated and disinhibited on the same time, over familiar with people. I mean, he would meet anyone that would be the first time, and he would say, and he would make a very good relationship. And if it's happening for 7 days, it means that the patient is having manic disorder. But if it's happened for 4 days, and if the functionality is not lost, if, for example, if he's a driver, he can do the driving, a cook, he's doing cooking, and the only thing which matters is the sleep and the talkativity, then it's the hypomania. So bipolar 1 and bipolar 2. Bipolar 1 is if somebody's have, let's say, 1 episode of mania, at least, or 1 episode of mania and depression, it's bipolar 1. And if somebody's got, let's say, 1 episode of depression and another episode of hypomania in which the functionality is intact, he's good at his functionality, then it is called bipolar 2. Then there is this bipolar 3. It's coming into discussions.
So do you think that medications like lithium salts and proper control medication actually help these bipolar people overcome their
let's
bipolar?
Let's talk about prevention. So I was reading this Oxford reference yesterday, the new Oxford. It says that lithium salts, I mean, there are edible lithium salts, which are, I mean, we should not go and eat the lithium battery salts. I mean,
but they do the effect of the battery, no? They make you ever ready.
I mean, so it's the same. I mean, the lithium works best. So it works best on our moods. So for the bipolar disorder, for somebody who wants prevention, must have the lithium salts and as an edible, but they should have their lithium levels checked every 2 months, minimum a month. And for somebody who, let's say, is a patient of bipolar disorder, with the lithium therapy and with the checks of having the blood levels and with the mood stabilizers, another thing is another therapy which is called the cyclorhythmic therapy, in which the person is able to live the life and he learns through the therapy to live without the medicines or with the medicines. It's really, really effective. I mean, he needs to understand that who are the right people that he wants to meet, and it's basically, the principle is to have a fixed routine in our life. So we do teach that about bipolar. So the bipolar 3 is because of the drugs. These days, Tahira, a lot of patients are here because of the drug use. And you see, I mean, can you guess which drug is on the top these days?
Right?
It's ice. I mean, everybody knows about it. I mean, back when we were medical students, we just read into our books.
We only had Nelbian.
Nelbin, and a lot of our doctors, unfortunately, and the nurses, they fall into this painkiller trap, and then we have to do that. But ice is very unfortunately common.
But a lot of young generation thinks it's very cool, and especially with all this advent of vape and all of this, and these, they've actually twisted their entire reality, which is very unfortunate.
It messes up with our minds, with our behaviors.
What is schizophrenia? If we could go a little bit into depth about what exactly is schizophrenia, how do we recognize the symptoms of schizophrenia, and how do we treat it if somebody is suffering from it?
Well, this is the crux of psychiatry.
Okay.
I mean, the main syndrome. So it's a syndrome. It has got a lot of other disorders in it, and so it has got mainly 2 to 3 types. To be very general, one is with the positive symptoms.
Okay.
In our terms, in the positive symptoms, the patient would be talking to himself or talking to a jinn, as in our
Okay,
culture,
yes.
talking to the spirit, talking
Okay.
to the dead grandmother,
Okay.
or listening to
Invisible friends and all
invisible friends and talking to them, and it would be happening there for a period of more than
of that.
1
And
month.
they have hallucinations as well,
Yeah,
where
yeah.
they believe that the person came,
Yeah.
said this to them.
Yeah, for somebody, for the viewers to understand, when somebody has schizophrenia or hallucination, that somebody is heard talking to someone as if you're talking to a phone.
Okay.
So the family needs to have a check that is he talking to somebody over the phone,
Or is he just imagining
or
it?
is it a Bluetooth? If it's not a Bluetooth or a phone, it
Okay.
means that obviously there is
Yeah.
hallucination. And then there is this delusion. The delusions have got various types. The most common is the persecutory type. Persecutory is like I had a lady. She told me that while she was seeing Facebook or the messages, the messages were intent to give harm to her, and there was a
Okay.
negative message over them. And I mean, every time she used to see Facebook or WhatsApp, she thought that people are
Are coming
inspiring,
to harm her,
her,
destroy
inspiring
yeah.
her. Her life is in threat. She is under threat.
Yeah.
Somebody is planning against her. So these are the 3 themes around the persecutory delusions, which
Okay.
are very common with the
Very
drugs.
common. Yeah.
So schizophrenia would happen with or without drugs.
Okay.
So without drugs, I mean, obviously we've heard about the dopamine imbalance. The other thing is having a traumatic event in life, PTSD, or unresolved mental health crisis,
Yeah.
like even anxiety disorder, depression. It worsens up maybe to some extent in some patients to become schizophrenics. So active hallucinations, delusions like paranoia, infidelity, in which the patient believes that their partner is not loyal with them.
They simply believe that, right? They have no
Tahira,
reasons
when
to.
we're in the marital
Yeah.
therapy, 50% of the patients, they've got these problems. Some of them have got these persecutory ideas. So we just treat them, and the
Right.
relationship becomes better.
Yeah.
And then there is erotomania. Erotomania is a delusional disorder in which the person believes that a very famous celebrity.
Is in love with them.
Yeah, I mean,
Yeah,
you
yeah,
see,
yeah.
I mean, the person is, the king or the queen or the celebrity.
Actually, it's good you told me about this. I once met a person, and he's very educated and everything, and he kept telling me that this very famous Hollywood actress is with him, and I actually believed it for a good period of time till I realized that there's something wrong with him, and the way they fool others, that is also very, very amazing. So how do they continue to fool others?
It's their actual belief. I mean, it's unshakable. So this is the problem. I mean, even if you try to give them 1,000 evidences.
They won't
So
believe
there was a patient who was brought to me about 3 days ago.
Yeah.
He had a pack of Capstan cigarette. There was a
Okay,
cigarette
yeah, cigarette, yes,
pack,
Captain.
and they were like small pebbles, stone pebbles in it. And after I admitted him, went through, and he was like, "Dr. Saab, I want to share a secret with you." And I was like, "What's that?" And he said, "I've invented the natural gas ingredient,
Okay.
and you have to keep it."
Yeah.
So you see, I mean, I did not like oppose him, and I
Yeah,
said,
obviously you
"Oh,
have to-
thank you so much for that." And we have to de-escalate them.
Yeah.
We have to make them, and then eventually, when they are better with the treatment or with the long or short stays and with the OPD visits, they forget about these things.
Right.
So yeah.
Okay, why do people in our part of the world, we are so cruel? If somebody has a mental disorder, we don't realize it could be just like any, an ailment in any other part of the body. We try to label them as unreligious. We try to label them as somebody who is, a lunatic or crazy or mentally insane. And then we socially outcast them, for so much so that people over here in the lower strata of the society, they start flinging stones at them and hurting them. Why do we not go for medical treatment? Why do we think that the mental asylum is a place to be scared of? Now you're running a mental asylum very successfully, and it's out there in the nature, in the woods, doing so much of social service to people. Could you please explain to people that there are facilities available like yours so that people don't have to let their children or their loved ones suffer at the name of lunacy?
Yeah. Well, you see, the stigma is very
very
much
severe.
here in our it's here in Pakistan, it's here in India, it's here everywhere in the South Asian countries,
unfortunately.
unfortunately.
Yeah.
And so it's very stigmatizing. I had a very interesting case. So there was a guy whose only property was in the province of KPK. There is a big problem.
Right.
So the owners of the lands, they're not the owners, some of them. So there's this Khana Kasht and then there's this Khana Malkiyat.
Yeah.
Nobody knew about it. Nobody knew about it. So all of a sudden the laws changed, and so the guy wanted to sell off his home and he wanted to shift to Lahore. You see, I mean, he could not do it because it was
The property was
the
disputed.
property was disputed in the
Okay.
papers and
Yeah,
because of the
yeah.
law. So these little so rather than people would sympathize with him, they were like, oh, you have to be brave, you have to bring some Hondas and stuff like that. So
Yeah.
unfortunately we have to
Yeah.
change our social
Change
values
the way
and
we
all
look
that.
at things.
And so,
yeah.
so the mental hospital, and the asylums were back in the British time, so we have got a hospital. So it's like it's on the base of community model now.
Okay.
It's not anymore a place where the patients are there for the rest of. You see, I mean, I've got my phone filled with messages of the families requesting that, okay, Dr. Saab, it's been a month. Thank you very, very much. Now, please continue the admission for 2 months for my son. And I'm like, doctor, please listen to me. I mean, the person is fine over the medications, or we've done the ECTs, or we've done the therapies. Now you need to
Take him home
take him
and do
home,
yours
and
part of it.
nobody's willing for that.
No, they don't want to do that part.
Then I
Nobody
get
has the
calls
patience to do it.
from XYZ and even the family members, doing sifarish of them, and I'm like, no, come on, I would. It's the human rights violations. I mean, why would I
Exactly.
keep
Why would
somebody
keep
who's
some-
normal now?
That is
So
so
you see,
unfortunate.
I mean, so people perceive that they are very dangerous, but they are not.
Right.
If they are on the medicines and if they are in remission, so they are not. Yeah.
Okay. So now let us talk about another very important thing. This is insomnia. Because people in our part of the world, they don't have insomnia. They've self-inflicted insomnia. They have very horrendous routines where they stay up the whole night and then they sleep throughout the day. They don't get vitamin D, they don't get good physical activity, and they like to stay awake at night. Could you please tell that if somebody has an actual problem, how do they get rid of insomnia? And if somebody doesn't have that problem, how important is this routine? Very important for your mental health.
It's the main crux of being well.
Yeah.
I mean, so there are things to do and not to do to counter insomnia or the sleep cycle reversal, or let's say if the cycle is disturbed. So the things that we have to do is to wake up at a fixed time, as you've mentioned. We have to have a healthy breakfast. It's really important. We have to do exercise for at least 30 minutes, and it should be at a time 5 hours before the sleep time.
Okay.
That's because we get very much
Otherwise,
excited.
we don't get charged up because of it.
We won't know, and we'll be so excited and happy, and we won't be able to sleep. I mean, because of the neurotransmitters
Exactly,
that kick in.
endorphins release.
Yeah. And so another thing to do is to mentalize. I mean, the meditate,
Right.
to think positively about themselves and about the world and about the next day. The things that shouldn't somebody do is to, number one, do not watch the clock while on the bed. Use the bed only for sleep purposes and related purposes. If somebody has to think about a negative thing or somebody bad or somebody which has...
Take it away and keep it outside the bedroom.
Get out of the bed, have a sofa, have a corner of the room, sit there, and then just
remove all of that, flush it out. Maybe go to the washroom and flush it out.
And for somebody who's in a hostel, you see, I mean, a lot of I went to the boarding myself for a couple of days, and a lot of other people. They need to realize that their partner
could carry negative energy.
Can be a successful person and can refer to their roommate as the best person they met in their life, or they could
with
take
the worst nightmare
with the
as
worst
well.
nightmare as well. So they have to take care about each other. And there's another thing, the tez masale wali cheeze. I mean, the
you avoid things that are spicy,
At the
avoid
night.
things that have a lot of caffeine in them, like tea, coffee, Coca-Colas, and all of those things. And also, what do you say about these children have sugar rush? Taking a lot of sugar at night, for example, a lot of chocolate, and then they start going crazy and
So there should be one fixed day in a week.
Okay.
This works. I mean, Sunday. So
to have all the sugar.
to have the sugar in the morning.
Right, not at night.
Yeah, not at the night. Obviously, it really messes up with the sleep and all.
So when we talk about relaxation techniques, do you advise yoga and Reiki and meditation to people? How important is that for them to relax as well? Because people have forgotten how to actually relax after a long day.
Yeah. Obviously, yoga, Reiki, along with that breathing exercises, PMR, lavender oil massage, it really works. So I got another lady She came from Umrah and she was all tied up and she couldn't walk and she thought that she might be, you know, having something wrong. She did something wrong there in the prayer or
guilt,
worship. She
yeah.
had this regret. So while I assessed her, there was only this regret. Nothing was there and she was not able to move. So I asked her if she can go to a physiotherapist and she can go do some physiotherapy. It worked. I mean,
Yeah.
only one physiotherapy really helped her.
Yeah.
So yes, obviously, yoga is good. Go to a beautiful spot.
Yeah, nature. Actually, conserve nature for that.
Yeah.
As well.
So there are two peoples. One have this locus of control to be internal. The other ones are external.
Yeah.
So the ones with external locus of control, they're social. They want to go out in
And
the
meet
nature.
people, yeah.
And the ones which have got this internal locus
Spend
of control.
time with yourself.
Yes, obviously. I mean, and they've got a lot of survival chance. Even if whatever happens in the world, they are happy because their locus of control is internal. But the external ones, like me, like a lot of people who are social, who want to meet people, they need to meet people with having their positive vibes. And if they think that somebody is not good with them, politely tell them, and just do not
All right.
spend time with them.
Thank you so much, Dr. Ehsan. It was such a pleasure talking to you, and it was
Pleasure.
wonderful having you. And the way you explained everything in detail was really phenomenal. Thank you so much. We really appreciate the time and the very great advice that you have given to all our viewers on this very important New Year's Eve, where we have just started everything off, and we started the new year with so much of positivity. And you heard it from the doctor, from the psychiatrist himself, that it is all about setting up a good routine, thinking positive, and fitting and making yourself physically as well as mentally fit. Thank you so much for watching.